Hi, I'm Varsha, a first year medical student at Imperial College London, and today we're going to be talking about the interview question, why medicine, and some tips on how I would answer that question. The timestamps are in the description, so if you need a quick summary, just have a look at that. Tip number one, your answer needs to tell a journey. So you need to try and emphasize right from the get go that there hasn't been one specific moment that has led to your decision about becoming a doctor. It's not just one specific moment. There was a build up of events and several different factors, and you have done a lot of research which led to the decision of you actually pursuing medicine as a career. Not just, oh, there was one wow moment where, like, I don't know, a family member got ill and that moment I decided I want to be a doctor. You can use those experiences as a way of actually helping you and in answering that question, but make sure you emphasize that there are many different things which come together and it's not just one thing. For example, like in my answer, what I did was I spoke about a event with a family member which triggered the interest in medicine as like a general, like what it would actually like to be a doctor. That's what I started to think when that event actually happened. Then I did research. Tried speaking to some of the doctors there, or like trying to arrange work experience in different hospitals, talking to students who are actually doing medicine, maybe in older years. I tried to get in contact with them. And then at the end, when I actually pursued my work experience and actually saw, like, observed what life as a doctor actually is with my own eyes, that's when I was like, okay, I want to do medicine. So it goes from 0% to 20%, then 60%, then 100%. It's not like medicine is just in a flash you decide in 100. It may seem obvious, however, if you just say that, oh, I want to do medicine because this happened to me when I was a child, that, I mean, okay, but that's not, you can't say that was the sole reason. Make sure you start off with a sentence starter, like, there are so many reasons why I decided. I can't really pinpoint one. You can say something like that, or you can say something like, several different things actually led me to decide. I've thought about it thoroughly. Deciding on medicine has been a journey of almost a year. I've actually did so many different things, volunteered in a care home, and then I actually decided at the end that medicine is the thing for me. So make sure you say something like that in the beginning, which tells them that why medicine was not just a spur of the moment decision. It was a build-up of events, and you have to emphasize that because it shows you are thoughtful, you have done your research about medicine, and it shows that you're not just shallow when you decided to become a doctor when you don't know what it actually entails. Number two, give a sense of what medicine actually entails. So briefly in your answer, make sure you talk about the roles and responsibilities of being a doctor. Refer everything back to your work experience because that is real life. That is not what you've seen on a television drama or something. That's real life. So you can talk about roles and responsibilities such as, oh, like when I actually went to work experience, I realized that there's more paperwork than I thought it would be in a doctor's role or responsibility. And then you can emphasize how that kind of interested you into like how that actually patient contact would be like a reward at the end of it. So when you like see all these doctors, right, when you saw all these doctors in your work experience writing down things like for 70% of the day and doing paperwork, but you can mention that it made that moment more special where they actually treated the patient and actually spoke to the patient. So those hours where they did ward rounds, you can say that the paperwork actually led to a build-up of those events. And obviously every job has its downsides, so make sure you mention the slightly boring aspects of medicine. Make sure you come up with something positive about it because then that will show that, oh, this person has actually been to a hospital and they are not making up something about their work experience. And then say patient contact was just more wonderful for them because they knew exactly what they were going into after doing all the paperwork. And then even then, like, the actual responsibilities are a must. Like, somebody has to do the paperwork, so doctors have to, like, that is just part of their role. And actually getting all the benefits of being a doctor, you wouldn't mind doing things like paperwork. Tip number three, you know the challenges that medicine has. So as I mentioned, this kind of links to the earlier tips. So you have to talk about how you know that medicine is not like the TV or drama shows in like Grey's Anatomy, in which, I don't know, everything happens so rapidly. Sometimes medicine can be slow. So those sorts of things. So that will show that again, it will show that you're well informed about medicine. You know what you're getting into. You do not have a dreamy fantasy version of what life as a doctor will be like and how it's going to be so cool, or you have like a realistic approach to what medicine actually is like. So mentioning the challenges won't actually seem like you're downplaying medicine or making it seem like a negative thing, the job as boring or whatever, but make sure you mention some of the challenges that a doctor might have, and then that will show them that, okay, this person has considered the good aspects and bad aspects, and they understand that they are capable of outweighing the positive aspects more than the negative ones. Be careful, but at the same time, just be careful not to belittle the challenges that a doctor might face. So like if you talk about the emotional aspects of being a doctor, don't just say something like, I find challenge really motivating for me. So the emotional aspect, I would find like I really enjoy it, and making families feel better about an illness that the patient might have or something like that, that will really inspire me to actually cure the patient and try and work my hardest instead of setting me back or holding me back, because I'm already both a practical and emotional person, so I can kind of deal with my emotions in that sense, and I can take a step back and think what is actually practical in that situation or scenario. Tip number 4, your answer can't be too long, and if it is long, if your answer is too long, what the interviewer will do is just cut you off. So if it's a panel interview, they will probably just interrupt you and just say, okay, now it's time to move on to the next question. And you wouldn't want the important stuff to be right at the end of your answer, which you haven't even said yet. So instead of going into lots of detail, leave hooks. So what hooks are basically like, you mention something like volunteering very briefly for like a second. So when you're talking about the challenges medicine has, say, oh, I also faced some similar emotional challenges in my care home work experience or in my care home volunteering, but don't go into detail. Just say, and in particular there was a specific patient, but I'm not going to go into detail on that. And then in the next question they can ask you a follow-up question on that. So it would be like a hook. So if the interviewer wants to ask you a question on that, they can. If they don't want to, then that's their choice, but it will keep them interested and engaged into the conversation. And you can maybe also mention another hook, such as like, interactions with a few patients actually awakened me to the realities of medicine. So how challenging it actually was for doctors to reveal bad news to family members and things like that. And then if they want to ask you more detail about those specific few interactions that you had with those family members or patients or whatever you observed, because you already said that, like there were a few interactions, so if they want to know, they will ask you about that. That will allow them to steer the interview in the direction they want you to, but it will also be like, you know what you're talking about, so it wouldn't be something completely unknown. Tip number 5, don't sound like a robot. Don't prepare for the interview in proper depth, like in terms of the answers and researching and things like that. But if you have enough time, don't prepare that first. Like if you have enough time, at least 2 weeks or a week, even a week, work on your enthusiasm. You have to smile a lot. Like even if your voice is pretty monotonous, like some people, like the way they talk is kind of like that, but even if you have that, video yourself and make sure you smile a lot, because smiling will help them know that you're a friendly person. They want to know if you're personable, if like you can actually talk to people, and if they can see you talking to people in the future like that, if they can see you as a doctor, if they can see you calming families down when they're pretty stressed out. Because in medicine, patients are at their most vulnerable position, like what they've ever been in their life. They might have never felt so scared before or so worried before. So will their family members feel like that as well? So you have to give across that vibe, which is really important. And there are a lot of studies and things which do say that tone of voice is more important than what you're actually saying. So make sure you work on the way you speak, and if you sound friendly and happy, especially if they talk about your hobbies, why medicine, smile on those sorts of questions. It'll be they'll really like that. Honestly, they'll really like that. The vibe that you give across will actually tell them that you truly want to be a doctor, and not just for the positive things, but also the challenges. The challenges also excite you to becoming a doctor, not just the positive things. So those are my 5 tips for answering the question, why medicine? And honestly, it's just a case of your answer being short and sweet, and making sure you know what exactly you want to put across in that answer, and just being yourself really. So make sure you improve your tone and the way you talk. That is the main thing which you should improve on, and that will also help you for the rest of the questions in the whole interview. Your why medicine answer will probably be the first questions you get asked in most interviews, or one of the first. So that will give across your first impression. So you have to be really, really excited about it and give across a really, really nice vibe to them. Please like and subscribe the video if you liked it, and if there are any other sorts of medicine interview questions which you feel like you would want some tips to, then you can leave them in the comment section below.